So internal hemorrhoids, they're normal structures and they're kind of like cushions in the rectum. They're comprised of nerves and blood vessels. So when you're younger, the wall of the rectum is kind of more muscular, but as you get older, that muscle kind of thins out and it becomes more fibrous. So there's kind of like this back pressure on these small blood vessels. Some patients bleed, and they could bleed significantly where it could be very scary to them. They could also kind of bleed and kind of soil their clothes, can be very embarrassing. Could also cause pain and itching. There's treatment options where you have conservative therapy, whereas, modifying diet, having a higher fiber diet, hydration. There's certain like Proctofoam creams or things that, patients can use, or sitz baths. These are more on the conservative side. You got these conservative therapies on this side that can give relief temporarily or not enough. And then you've got all the way surgery on this side. Before the hemorrhoid artery embolization procedure, there was nothing in the middle. So patients would be like, they don't want a hemorrhoidectomy, so they would just suffer. The procedure that we perform, we go through the circulation, everything's sterile, and we go down through the circulation. We block the small blood vessels going to the hemorrhoids, and those are the only things that we're blocking. And then the patient wakes up with a little Band-Aid on their wrist. So this procedure is very low recovery, not very painful at all, and also has the lowest recurrence rate. I have a lot of patients that come to mind, but one guy, was very miserable. He would bleed heavily with every single bowel movement. He was anemic, required transfusions, believe it or not, for hemorrhoids. We did one single procedure on him, and everything was very, very effective. And he hasn't even had a single episode of flare-up or bleeding since the procedure.